I know. It should come up now. There we go. It says excellent connection.
I'm going to see Jimmy Buffett this week.
Okay, there we go. We're up.
That's what I heard.
Okay, doke.
Are we ready to rock and roll?
Yeah, I think so.
Let's get it on.
And if we're not too bad.
As long as you're recording.
That's what editing is for. All right, you ready?
Let's do it.
Let's do it.
Here is that sound. It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my inevitable woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve and my little pal Dr. Scott, the traditional Chinese medicine provider who gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And in the studio, we also have Dr. Carey. Hello, Dr. Carey.
Hello, Dr. Steve.
And we got one. Well, we have Amanda, but we haven't figured out her radio name yet.
Hey, what's up?
Okay, well, there you go.
And again, hi, I'm Tacey. I'm also part of the show today.
Okay, I was getting to that.
No, you weren't.
Most
course I
important
was.
for last.
This is a show for people who never listened to it. Hello, Tacey. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4334. That's 347. Take it, Tacey.
Nope.
Poohhead.
Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, yoga master, physical therapist, or whatever. All right, very good. So, welcome, Amanda. This is your first time on the show.
Yeah.
Although you and I do another show that can't be named.
Right.
But, yeah, it's good to see you. So, yeah, and you and Carissa are over there having a drink. What are you drinking?
Ask
Cheap
Stacey.
wine.
Okay, very good. Yeah, Tacey gave it to him, so it's cheap wine. Anyway, all right. Well, I know, Carissa, you brought a weird medical news, and this is not like Scorch's weird news. These are actual interesting medical topics. So what have you got?
Fair. I also don't have something nearly as interesting as previously when I
Okay.
was here. That's hard to be topped. But I do have just a weird piece of news that I wanted to share with you. and
Okay.
It's about a restaurant in Las Vegas
Okay.
that's called the Heart Attack Grill.
Okay.
And their most recent thing is that they have displayed the cremains of one of their customers
Oh my God.
Oh, my God.
because their burgers
Killed him.
killed them.
Oh.
And they now are displaying their remains. Yeah.
I've actually heard of that restaurant.
Yes.
I've wanted to go.
I mean, their burgers are called like the heart attack or the quad bypass or
Oh my goodness.
yeah.
What's the name of this place?
Flatliner fries. Just
Flatliner fries.
Heart Attack Cafe, I believe.
God.
And so, what's so bad about their burgers? They're
I
just
mean,
being hilarious.
I don't think that there's anything necessarily bad about theirs. It's just
Yeah.
those ingredients are known to
It says
cause.
people over 350 pounds eat free. Oh no.
Yes.
Oh no.
no.
I'll have 10 of those. Let me see.
So and
Oh
the-
my God. Weigh yourself here.
and the owner wears like a doctor's jacket, like a lab coat.
Oh my God. Look at this thing. The octuple bypass burger. It is stacked. It's got to be 2.5 feet tall with burgers, cheese, and bacon.
Yeah.
And it's just layered.
Yeah.
Oh my. And then tons of onion. That's got to be a whole onion. I'm not doing that.
Nope. No. Not for me. So when I was just out there today
Oh, no.
looking around, I just came across this and I
And then-
thought it was hilarious. So
These people are hilarious. When you go into the men's bathroom, there is a urinal with Hillary's face on it, but there's also one with Trump's face on it. So it's, if you're a leftist, you can go piss on Trump. If you're right leaning, you go piss on Hillary. And and they both look like they're enjoying it.
that's a whole nother concern.
Yeah, triple bypass burger, and then if for another $2.75 you can add 15 bacon slices.
Good not.
Oh my God.
So yeah, apparently one of their customers had a massive heart attack after eating there, and the cremated remains are going to be publicly displayed, but the owner's trying to swing it in a way of bringing awareness to how bad that type of food is.
Okay, that's like saying me doing Tippy Tom's prostate exam was bringing awareness to men's health. I mean, come on.
correct.
All right. Okay, let's see here. Oh my God, wine is served in an IV drip bag.
Hey,
Now we're talking.
And I'm pretty sure the waitresses wear nurse uniforms.
I
Yep.
think they do.
And if you
And
don't
scrubs
finish
and
your
stuff.
burger, they'll spank you.
Oh,
Oh,
stop
nice.
it.
I used to have to plan
terrible.
dinners for our groups when we would go to Vegas.
Yeah.
And I tried to get our groups to go there, and nobody
Really?
would ever bite. Yeah, I
Yeah.
thought it would be fun.
Well, those groups were stupid. I remember when we got we were able to go on a trip to Australia, and these people that we went with, they actually went to the concierge at the Sydney Four Seasons and said, "Y'all got an Outback?" Because
Oh,
we're in
for God's
Australia,
sakes.
right?
Oh my god.
And the guy said,
Oh
"Yeah, we
my
got
God.
4,000 miles of it. You're welcome to it." And then we wanted to go. Where was it? We went. Oh, okay. So can we tell this story now that you don't work there anymore?
I mean, just say we had a lot of money
Okay.
to spend.
We had a lot of money that we
On
could
dinner.
spend, and they said don't spend X number of dollars per person per meal, and it was some insane amount of money. This was back in the.
It would have provided for a great meal.
Yeah, right. So I went to the concierge. I said, "What's the most expensive restaurant in Sydney?" And they came out with this thing. It was called Level 14, I think. And you could sit in the kitchen with the chef, and they would make you a 14-course meal with a wine pairing with each course. You know, a little bit, not, it'd be hard to drink 14 things of wine. And, well, okay, fair enough. Forgot who I was talking to. But, and so it was like, we are going to this. We have to, because it was kismet, because the amount was exactly the number that they had given us per person. So we would have had to kick in the tip. But, who cares? This would have been an amazing experience. And we went to them, and they were like, no, we want to just go get a steak. We want to go get a steak. So we ended up going to this steak place, which actually was kind of cool. We had a view of the Sydney Opera House across the bay. We were right there in the quay. And so it was okay. But, they just, and the one guy, okay. The one guy, he just wanted a cheeseburger the whole time we were there. I just want a cheeseburger. I want a cheeseburger. So we got off the ferry from Taronga Zoo, and there was this burger place. It had a big giant picture of a burger there, and he goes up there and says, "I want a burger with everything." Well, in Australia, that means something different than it does here, because here it's like lettuce, tomato, pickles, mayonnaise, onions, and ketchup and mustard. There, it was, a burger patty, cheese,
Eggs.
yes, lettuce, tomato, a giant slice of beets, and a fried egg and some other bullshit that was on there. And it was like, dude, you asked for everything. Now you fucking eat the damn thing. Here's your burger. Welcome to Australia. God, it was such a great trip. And anyway, that's what happens when you go with folks from the holler, don't you know? But anyway.
Isn't that where you're from?
Mm-hmm. So they serve Jell-O shots from a giant syringe at this place. And oh my God, 4.5-pound hamburgers, 3 tablespoons of lard, 20 slices of bacon, 8 slices of American cheese, 20 slices of caramelized onion baked in lard, 8 tomato slices, 1 tablespoon of mayonnaise, only 1, 2 tablespoons of ketchup, and a tablespoon of mustard.
Now, the mayo, I don't know why they've gone so short on that.
That's what I'm saying.
Right.
Yeah, no, I mean, it should be like a half of a thing of Hellman's mayonnaise, or Blue Plate, which is the only good mayonnaise.
No, Duke's
Yeah, okay.
in the South.
You'll get people to fight you for that one, but I will concede that Duke's is pretty damn good. All right. Well, listen, in the waiting room, we have our boss, Mr. Cardiff Electric, who I want to give a plug for. He does kind of a surreal podcast called the Cardiff Electric Podcast, but he interviewed our friend Eric Nagel recently, and it was great. It was one of the best things I've heard. And there is an Easter egg at the very end of that podcast, and I will send a mug to the first person who tweets to me what that Easter egg signifies, and that's all I'm going to say. If you know it, you'll get it. But anyway, you got to tweet it to me at Weird Medicine. All right, very good, and congratulations, Mr. Cardiff, for another great show. And he has call-ins from lots of people all over the country. There's Gary from San Diego. There's some guy named Cletus that calls in. I don't know. There's just all kinds of different things. So enjoy that, the Cardiff Electric Podcast. It's the most surreal thing in so many in-jokes. Most people just will go, what in the hell is this? But that's half the fun, All right. What else have you got? That was good.
Interesting.
Yeah.
So I was reading about this story of a 16-year-old boy who had premarital sex and felt really bad about it.
Uh-oh.
And he was really stressed out from just life events.
Yeah.
Well, he went to bed that night and he woke up in the middle of the night and couldn't move and was having a terrifying hallucination of a humanoid.
Oh, so
with
he was having
very
a
dark
hypnopompic
eyes.
episode, yes.
And his body was just frozen and he couldn't do anything. And
Right.
so I know you and I talked about this recently.
Yep.
And then he went back to sleep the next night. I don't remember something. And he had like told himself ahead of time that he was going to get rid of this being that he was hallucinating by
Right.
saying Jesus' name over and over.
Okay.
And he popped out of it.
Interesting. Yeah.
I
So so what he was having was a hypnopompic episode. Tacey had those.
Mm-hmm.
And we've talked about it on Patreon. We haven't talked about it so much here.
Terrifying.
Yeah.
Do you you want to tell the story of what
mean-
you heard? I've told my story of hypnopompic episodes before. And for those that don't know, these are episodes that occur as you're emerging from sleep rather than emerging into sleep. And it's also called sleep paralysis. Go ahead.
I think it's been a while, but I think Chanda was on the show that we did.
Okay.
But mine was in a hotel that I used to spend 2 or 3 nights at a week, and I would have them, and somebody or something would lay down on top of me, not in a sexual way, and I just couldn't move.
Yeah.
And then I would always hear them scurry away, and then I could get up.
Yeah.
It was weird.
And then we talked about it on the show. I gave Tacey a technique for breaking hypnopompic episodes. And it never happened again. She still was on the road, but it just never happened again. And I wondered if just giving her the power to do something made them stop. Because the person in that story, it doesn't matter really what you do. I mean, he invoked, his religious figure. Some of any gesture you can make to exert control over that hypnopompic episode will usually break it. And mine was that I forced myself. I was paralyzed, but you're dreaming, but you're paralyzed, but you're also awake. So there are, all the visual and auditory things in your dream are still going on, but you're conscious and you're like sitting there going, I'm completely awake and all this crazy shit is going on and I can't move my body. But you can harness the fact that you're sleeping. And what I did to break these, and it really never happened again after I did this, was willed myself to levitate. I couldn't move. I couldn't use my muscles, but I could will myself to levitate, just like you can in a dream sometime. If you're, running away from something and then you do those weird jumps where they're way longer than they should be, and then sometimes you're flying, and then other times you're flying and then you can't fly anymore, but you can do those sort of, extended levitations, basically. And so I just willed myself to levitate upright. And when I did that, I looked over to the left and there was a hospital gurney in my bedroom, which was, of course, was always the sort of archetype of the alien abduction thing. They always take them on a gurney and take them somewhere. So, but as soon as I saw that, it surprised me and I woke up just like that. And that was the last time it ever happened because I exerted some control over it. The person in that story did that. Tacey was gonna exert control, and I think, the thing just, whatever that switch is in the brain just went, oh, fuck it.
The ghost went away.
Yeah, right, right.
Place was haunted.
Yep. Yep.
Vagrants used to.
Every time I tell I do my hospice and palliative care lecture, I talk about you, Tace, because one of the slides that I show is about that there's more deaths in the ICU than anywhere else in the hospital, and I stop, and I say, my wife likes to watch these ghost shows. You ever watch those? Where they put a GoPro on their head and they turn off the lights and they scare themselves. And I said to Tacey one time, why are you watching this? She said, well, in this hotel, 3 people died on the 3rd floor, and now it's being visited by poltergeists. And I said, if that were true, every room in the ICU, the pictures would be flying off the walls and you'd be hearing, get out, and all that kind of stuff. It just doesn't happen.
You just don't listen.
That's another thing I came across today, though, is that one healthy thing you can do for the day is watch a horror movie.
Really? Why is that healthy?
Because it makes you burn calories.
Oh, get your adrenaline up?
Yeah.
Unless you, yeah. Even if you laugh at it, it's probably good for you. Anyway, okay.
Instead of exercising. That
So
sounds
somebody did a
great.
study on this. If it was NIH funded, I am going to be pissed.
On horror films?
Yeah, I mean, if the federal money was spent, looking at the caloric rate of people watching.
There
The basal metabolic rate of people watching horror films.
there was a study done.
Yeah,
And I don't have it with me who
Okay.
it was through, but it does have a
conveniently.
breakdown of certain calories that, like Jaws, the average person burned 161 calories watching Jaws.
How much do you burn when you're just sitting
Just
there?
sitting, probably about the same. I
Well,
mean,
well, okay, that would be
depending on who
something that
you
is
are.
important. Were there other movies that burn more than that?
Yeah, The Shining burned 184.
Extra 20 calories.
Coming
How about,
in at
how about
top.
Debbie Does Dallas?
Yeah, that might.
Depends
That might
on
have been
what you're
a couple extra calories.
doing during that.
Yeah.
Right, it depends if
movie.
Tacey's home or not when I'm watching that.
Uh-huh.
Because if she isn't, there's other stuff that goes on. Yep.
There you go.
Yep.
Honey, get out. Well, never mind. All right. You want to take some questions? Oh, wait. Yes, we have. I made a mistake last time. It happens. And during our talk about when people have transfusions, if they are.
Everybody call me
Jesus.
crazy, but my name is...
Okay, sorry.
Wow.
I ruined the joke, but anyway, it's not even a joke. Let me just fix
That's
that.
going to scare people.
I
Steve.
know. Let me fix that. Hang on.
Well, we just burned some calories.
Hang on. There we go. Whether DNA is transmitted to other people during transfusions, somewhere I said that apparently that WBCs don't have DNA, and I meant to say RBCs. So I have to thank our friend Bob Thibodeau, and he even has his own theme song because he sends me a lot of emails about this kind of stuff, and it's
Everybody call me crazy, but my name is...
Bob.
Thibodeau. Everybody call me crazy, but my name is...
Bob.
Thibodeau.
All right, that's it. All right. All right, Bob. Thank you for that. All right. Did we do the one on the person that suffered a scary sexually transmitted? We did, didn't we? Where the woman gave the guy fellatio, but he had eaten peanuts and there was peanut
Oh.
allergy.
Yeah.
Yeah.
She was a OnlyFans thing or something.
Yeah.
Yeah.
So
Yeah.
I did some research on that, and there was some truth to this one. And so that, there are some proteins that can be transmitted sexually, but mostly it's oral. And this is people who have eaten peanuts and then they, tongue somebody that has a peanut allergy, because it doesn't take much. As you know, some of the people that have anaphylaxis to peanut protein have a reaction with a very low exposure, and so I think that's where that came from. I don't think it was from the guy's splooge. I would like to see if we could detect those peanut proteins in semen. It'd be a fun study to do. That's when I would support the NIH, funding. But anyway, all right.
Eat peanut butter and
Yeah.
test
Yeah,
split.
just have them eat peanuts and then give them 24 hours, have them, splooge into a cup, and then see if you can detect that particular protein and that wasn't there before. Anyway.
Would be interesting.
Yeah. All right. Well, that's how we know things. Let's do, you want to take some questions?
Yeah, let's do it.
One thing, don't take advice from some asshole on the radio.
All right. Thank you, Ronnie B. All right. Let's see what we've got here. Oh, come on. Not with this shit again.
Hey man,
Thank
can you
you.
talk about PTSD?
Oh, sorry, man. That's not the right question. Okay, I'm going to pause it again. Sorry. God. All right, let's see here. Why?
The causes?
No. Let me see what this one is. Okay. Okay. Hang on. There we go. I don't know what's going on.
Hey, Dr. Steve.
There we go. Okay, we're good. We're
Probably
good.
my fault.
No, yeah, it's your fault.
Everything's your fault.
Okay, you ready? Here we go. I'm just going to splice it in right here.
I'm just dying of heat.
Are you?
It's normal.
Okay.
Hey, Dr. Steve. Matt in Charleston.
Hey, Matt.
Binaural beats. Read an article on it about how it can do all kinds of stuff to your brain. And what's, like one tone goes in one ear, another tone goes in the other.
Yeah.
And it adds up to some other tone being perceived by your brain.
Right.
Or something like that. Is this horseshit, or is there any real truth to this? Thank you.
No, it's real in the sense that when you put two different competing tones, one in the right ear and one in the left, you can perceive it as different things. And so I know the Trip app uses binaural beats. There are other, it's called a digital drug, and people can use binaural beats to attain different, senses of consciousness and stuff. I'll play one for you if you want. Let me see if I can find a good binaural beat here. Yeah, here we go.
The old Led Zeppelin song,
Is that
Black Dog.
really? That used binaural beats?
I think so.
So they have used binaural isochronic tone patterns between 12 and 20 hertz. This is the alpha beta range. Helps you increase concentration and vitality. Okay, so how would we know if this stuff actually did that?
It's very calming.
Makes me want to sleep.
What kind of test would you do to see if this actually works the way that people are claiming that it does? Anybody?
Ask him.
Oh my God.
I'm sorry, I was enjoying my binaural.
Oh, is that what it was?
I think we all were.
Yeah.
How about a double-blind placebo?
So how would you structure it?
Well, you would first of all have a group of people that agreed to the testing. You'd have a group of people set up the test, and none of them would know what the other one was going to get.
Yep.
And that'd be a good first start. And then
So
you could check serum blood levels, serotonin levels, or cortisol levels, or you can just have a questionnaire. I mean, I'm sure
so you'd have to have
yeah,
an endpoint.
1,000 different things.
So
yeah.
what are you looking for? Because with the Viagra initial Viagra study, their endpoint was blood pressure.
Yeah.
It wasn't giant meaty erections.
I was thinking, for some other reason, I thought it was for hair follicle.
No, you're thinking of minoxidil.
Okay, yeah, I'm sorry, yeah. Blood pressure, right.
Yeah,
Right.
so it was blood pressure, and then people were reporting, God, I'm having these crazy erections. And they had to do another study with the endpoint being erections,
Right
because
on.
you can't use a secondary, just an adverse effect, and then go to the FDA and say, oh, look, or a side effect. But anyway, so what were you going to say, Amanda?
I was going to say, what about doing like an EEG or a CT while they're
Sure,
listening?
I like that.
Functional MRIs.
Yeah.
So
maybe,
what that
that'd be
would
cool.
show is changes in your EEG, which would mean it has some sort of physiologic effect.
Mm-hmm.
I'm sort of interested in the real world effects of this. So I'm not saying that's a bad study. That could be an intermediate study. But they're saying
You're saying I suck again. It's
they're
fine.
saying it
Yeah,
helps
pretty
you
much.
increase
Pretty much.
concentration and vitality. So how do you measure that? That's the thing.
Mm-hmm.
So the way I would do it is to have music like this, spa type music, as the placebo, and then music that uses these isochronic tone patterns between 12 and 20 hertz included, and have
Like
the people do
Pre
some.
and post performance.
Yes. Yeah. It could be, there's ways that you can measure concentration. The psych people have validated studies for that. And you would nobody would know. The person wouldn't know. The researcher wouldn't know. The computer would choose them randomly. And then at the end of it, you unblind everything and see if there's a statistically significant difference.
Oh, so you're gonna turn it down. You're losing everybody.
So anyway.
People drive and listen to this. Steve.
Do they? Does anybody?
Yeah,
really listen, no.
Kim Chick,
but,
Kim
I mean,
Chickens is saying she actually listens to this while she's studying for board exams. Did pretty well. Yeah, that's a good idea.
I used to listen to an instrumental song, the same one, before every test in college.
Oh yeah. What
What
song was it?
You would ask me that, and I should know because I took a lot of tests.
Pock Bell, maybe.
No, it was something really random for me. You say it best when you say nothing at all. Instrumental.
Oh, Alison Krauss.
Alison Krauss.
Oh, yeah.
Oh, see,
that's the real deal.
stuff.
Man. That's the real deal.
I
You're
would
just
listen to it on my way to taking my test, and it just calmed me down. It
Do you
just
think
put me in
that's
the
sort
mood.
of like somebody that wears the same, like a pitcher that wears the same set of underwear before
Right.
they pitch?
I don't
yes.
Yeah, it might be some of that.
We've had that talk about me, haven't we?
Mm-hmm.
Yeah. My favorite underwear. Kind of just calmed me down.
Yeah.
I wore the same underwear playing baseball all the way through high school and college.
Wow.
The last game, I
Did
wadded
you
up and threw it away.
wash them between
I did
games?
wash it, yeah.
Okay, good.
It was pretty holdy. I wound up having to wear extra underwear underneath the holdy underwear.
Anyway.
But I felt much better about myself.
So here's some people that did a study on receptive music therapy with embedded 10 hertz binaural beats compared with standard care for patients with major depressive disorder. This was a randomized controlled trial. Excellent. Purpose of the study was to determine the effectiveness of music therapy with embedded 10 hertz binaural beats in combination with standard treatment in comparison. You know, the objective is exactly the same as the title. That's always a bad sign. But anyway, so they did a randomized trial enrolling as very small, 18 major depressive disorder adult patients aged greater than 20 years old with mild to moderate levels of acute phase depression. The intervention group received music therapy along with standard treatment, while the control group received only standard treatment. This really isn't a placebo-controlled trial. They randomized them, but they all knew, hey, I got the music. The other people knew they didn't. So 10 hertz binaural beats were embedded into soothing music. These participants listened to it via stereo headphones, blah, blah, blah. Okay, so the conclusion was the study concluded that major depressive disorder patients who received 10 hertz binaural beats embedded music therapy combined with standard treatment had experienced no significant differences compared with the control group. In terms of depression score, quality of life, or medication adherence. So there you go. So that doesn't mean that it's all bullshit. It just means that 10 hertz binaural beats didn't work for this cohort, you know. So there may be other studies that they could do on these things. Just like, you know, if they just quit with Viagra and said, well, it's a shitty blood pressure medicine, you know, that would have been kind of crappy for all of us failures, you know. All right.
I mean, it's crappy for the women, too.
I guarantee
yeah, right.
But we don't give a shit about you, do we, Dr. Steve? It's just all about us.
Well, we do if
right.
you're just trying to jam, you know, a cooked spaghetti into a, I don't know, into something
Next
that
subject.
would just not accept
let's
a
go
cooked
on.
piece of spaghetti anyway.
Moving right along.
All right.
Yeah.
Very good. All right, let's try this one. This is a good one. Oops.
Albuquerque again.
Hey,
How
man.
you doing?
Hey, good, man. How are you?
Great. Hey, listen, I was just listening to one of your shows as I'm driving down the road and talking about somebody with very high testosterone.
Yes.
And I had the same thing recently where I went in for a physical and just anecdotally said to my doctor, why don't we take a look at my testosterone?
Okay.
And he did a testosterone, test during my blood sample, and mine was 1100. So I ended up going to an endocrinologist to find out what the hell's going on with that.
Yep.
And they said that they did another testosterone test where they didn't look at total testosterone. They looked at free testosterone and total testosterone separately.
Oops.
My free testosterone was in the normal range. My total testosterone was very elevated, but so was I believe it was the serum globulin sex binding hormone.
It's close. Sex
that
hormone
just
binding
happens to be
globulin.
naturally high in me, which drives the total up regardless of the free testosterone.
Uh-oh.
So the endocrinologist said this is a non-issue. We don't factor for this. We don't look for this because it's not indicative of anything. But I don't know if that's the other dude's problem or not, but I figured I would mention that because mine became very innocent. I asked my primary for testosterone. He did total. And what we really need to do is a breakdown of free versus total and also look at that sex-binding hormone. So, anyways, hope that might have some relation there.
Yes. Thank you.
Have a great day.
We
Tell
don't.
Casey we said hi. Take care.
Hey, Casey.
Hi.
See, he remembered you. We don't talk about sex hormone binding globulin enough. And as I recall with that guy, we said, look, this could be lots of different things. You need to see an endocrinologist. And because I didn't want to get too far into the weeds on this. But, since he brought it up, sex hormone, yes, you have total testosterone. And that is all the testosterone in your blood, by concentration. But that includes testosterone that is bound up by protein. So some testosterone gets bound up in these globulins, and you can't use it. And those, we call those sex hormone binding globulins. Some of it also gets bound up in albumin, and that's also not free. So what you're interested in is the free testosterone. So if you've got somebody with 1,100 testosterone and they are not symptomatic of hypertestosteronism, then they're probably okay. So you check their sex hormone binding globulin, it's elevated, their free testosterone is normal, then, we don't have to necessarily just, go crazy and do something about it. But I am concerned that they just kind of blew this off. Because if you have elevated sex hormone binding globulin, it can be a sign of liver disease, but the one that they might not catch if they don't test for it is hyperthyroidism. There are other eating disorders, and it could have pituitary problems. There's all kinds of things that could cause elevated sex hormone binding globulin. So just going, well, that's just how you are. That's not thorough enough for me. It's probably true. If you're in Upper East Tennessee and you're standing in a field and you hear, cloppity clop of hoof prints behind you, you're going to assume it's a horse. You're not going to think it's a zebra. But every once in a while, it could be a damn zebra, and that's why we always, go the extra mile and try to dog things down. I just want to rule out some pituitary issues and hyperthyroidism. I do some liver stuff. I do an albumin. I do some other things like that just to make absolutely sure. But yeah, when this comes up again, we probably should talk about free versus total testosterone. But, we just, it's a long, like I said, you can get into the weeds with this. So anyway, all right. Thank you. I'm glad you brought it up because it is something interesting that we can talk about.
Totally.
Here's one for Dr. Scott and for...
Hey, Dr. Steve, it's Albert from Albuquerque. How you doing?
Hey, Albert, same guy.
Great. Hey, hope Casey's doing good, too.
Yep.
Hey, I wanted to follow up with you. Last time I gave you a call was pre my prostate being removed.
Okay.
And post on the other side of the surgery now. No real questions, but a comment around the recovery. The surgery itself was a Da Vinci method and laparoscopic robotic with the suprapubic catheter installed instead of just a Foley catheter post-surgery.
We should probably
Things went
translate
great.
all those things. So he said he had a Da Vinci, so that's robot, basically, robotic surgery. And then what did he say? He had a suprapubic catheter.
Yeah.
So that is a catheter that they actually, rather than going up the urethral meatus, a.k.a. the cock hole.
A.k.a. the worst idea in the world.
That's awful. You will hit somebody's car and then leave the scene of the crime when that happens. I can speak from experience on that one.
Then the police show up.
Yeah. Well, I looked. I got out and looked. But anyway, that's another story for another time. So suprapubic catheter, rather than doing that, they go through the basically the way lower abdominal wall, just above that pubic bone in the front, and then go into the bladder that way. And you can do the main reason to do that is it bypasses the prostate, because if you pass a catheter up the old urethral meatus into the bladder, what's it got to go right through
Right,
is
dead center prostate.
This prostate that's just been
man.
operated on, and that's really irritating. It's going to cause bleeding and clotting and stuff like that. So really, you're safer, sticking a trocar, which is just basically a big sharp nail, through your suprapubic abdominal, pelvic wall.
Kind of like tapping a maple tree for some
Exactly
maple syrup.
right. Very
That's
good.
kinda all
I'll
it is.
give you that. That's a good analogy. And that's actually safer than shoving a catheter up your cock hole. So.
Well, and plus the post surgical removal of that thing. Oh,
when it's
hell.
socked in there with all the
Fire.
blood and stuff, it's good for you.
Oh,
All right.
thanks.
For that's going good.
Good,
the
man.
issue I had was post-operative ileus. My GI tract just shut off, and spent an extra day or so in the hospital. Got home, and when I first night I got home, I was just violently sick at my stomach. I could not digest anything. Nothing.
So, post-operative ileus is a big deal. There's way more to his question. We'll let him finish it, but let's talk about that for a minute. We see that all the time, and the osteopaths have a maneuver for that. Have you guys ever learned this?
No.
Okay. So what the osteopathic physicians will do is the patient's laying on their back. Let's talk about what postoperative ileus is. It's the bowel doesn't like being messed with, and it doesn't like other parts being messed with either, and it'll just shut down.
Mm-hmm.
Sometimes the pain medication that we give will also contribute to that because it will paralyze the bowel or at least make it lazy. So what they do is lay people, they have the person on their back, and they'll slip their hands under their back until they get to the paraspinal muscles, and these are, that's the back strap right next to the spine, and then they will just they'll make it kind of like a hook out of their fingers and put tension toward them and pull back on those. And I've watched them do it, and sometimes that'll, you do that for a couple of minutes on both sides, and sometimes that'll do it. They also recommend chewing gum. Chewing gum will sort of get that gastrocolic reflex going, because we have this reflex that when you're chewing stuff, your colon goes, oh boy, oh boy, oh boy.
Here comes some food.
Here comes some food
Here
and
comes
some
action,
vittles.
Some vittles.
I'm going to turn it into fecal matter. That's what the colon says. But anyway, so chewing gum is, and we have some medications for this too. So, all right, but anyway, and it sucks when it happens.
Would go down, and I ended up throwing up about 2 cups of just dark green bile, which I felt better after that. And then I hit myself with some laxatives the next day and cleared my bowels, and felt amazingly better after that. Unfortunately, a couple days after that, I had a second bout of ileus, and I got ahead of it before it was terrible from a standpoint of throwing up, but ended up with some cramping and gastritis and some other issues with that. So I'm wondering if there's any better way of preemptively getting ahead of the ileus. I know it happens frequently. I got up, I moved around, I did everything they said to do, but man, it was hell.
Yep.
Anyways, good news on the follow-up of the pathology is the biopsy showed a Gleason score of 7, which was actionable, and we just made the decision to take the prostate out.
Yep.
Post-surgery, the more finite pathology showed a Gleason score of 8. There was a different type of cancer discovered, which was more aggressive.
So they did the right
It
thing.
was also protruding from the prostate. They got the margins and the lymph nodes in the area all were negative.
Okay,
so
good. Yeah.
Hopefully, keep my fingers crossed. We got everything covered, and I'm done. I'll follow up with my surgeons afterwards. But your feedback on ileus and maybe doing a little bit better. The hospital I went to, I loved the nurses. I sent them cookies and cupcakes afterwards. They were phenomenal, just lifesavers.
Yeah.
Awesome.
But if we could have avoided that
Yeah.
misstep, it would have been a lot easier recovery.
Well, and I appreciate that, and it's just everybody's different, and some things that will prevent it for me won't prevent it for you. They try to get people up. We used to have people lay in bed for days after surgery. Now they're just, it's like, get the fuck up,
Get out of here. We need a bed.
Yeah. Oh, God, when I was training, if you had a C-section, it was 5 days, and if you had a vaginal delivery, it was 3 days. And our second kid, really, were you even in the hospital 24 hours?
I have no idea because we ended up back there so soon after.
Yeah.
I don't, Steve, I don't remember.
Yeah, okay. Well, anyway, it was pretty quick. Yeah.
It was less than 24 hours with my second.
Yeah.
Yeah.
I've known people that came in at 6 in the morning and left at 4 in the afternoon with their kid.
Especially if it's not the first kid, I would assume. The
Right.
Third kid's probably a little bit easier.
Yeah.
Other ideas for Elias? I mean,
Yeah, you guys got anything?
we've got some stuff too. So.
You do? Yeah.
Oh,
well,
yeah,
you okay?
sure
Well,
do.
you talking
Yeah,
about
yeah.
it.
I was gonna say we believe it or not, we put needles in those paraspinal muscles the same way, and then a little bit of electrical stim. I'll do small needles in the abdomen with electrical stim.
Huh.
I'll do a little bit of cupping, moving cupping, where I'll actually put a little coconut oil.
Cupping their balls.
I'll cup their balls. I'll put a little cupping on the abdominal wall. Put a little coconut oil on there, and just do it, kind of following the colon around.
Okay.
With a cup, and just to see if you can stimulate a little.
Yeah.
And sometimes it helps.
I mean, I don't know if it's proven, but my husband recently had surgery,
Mhm.
and I massaged his stomach when he was
sure.
just feeling
Yep.
constipated afterwards.
I've
so-
done that as well, where
Yeah.
I start in the cecum, which is the lower
Right,
right,
and just-
and then work your way up to where the liver is, across the transverse process, which is across, the under the rib cage, and then down on the left side, and just do that repeatedly. And sometimes that helps. I think I've done that to you, haven't I?
You
Tex?
have.
Yeah.
And you can tell if you've done it enough. You can tell if there are some adhesions in the abdomen when you're running your fingers across,
Yeah.
and you can kind of feel if there's something you just need to kind of easily work through. And sometimes you can get the bowels to start moving pretty quickly.
I have a weird sixth sense for putting my finger where things hurt, by the way. I just want to throw that out there.
Yeah.
I have patients come in and they say, well, my shoulder's hurting or whatever. And, where I work at a cancer center. And I can usually just take my finger and go, does it hurt right here? And they go, oh, yeah, that's where it is. And I don't know where that came from. And it's not something that's like 35 years or 37 years now of doing it.
Yeah.
I've always had that, And some of it's just knowledge of anatomy.
A lot of it's knowledge of anatomy, and knowing your people. But I swear, I think sometimes if you're really into it, and you do kind of just feel there's almost like a magnetic pull.
Yes, that's what it is for me.
Yeah.
It's like a magnet that pulls my finger where it is. I did that on Carissa the other day.
Yeah, I didn't even know my hip hurt. Where you?
Yeah, tell the story
found.
because you tell the story about how awesome I am.
Oh shit!
Oh,
Here we go.
okay,
Like,
yeah.
can we get some music?
yeah,
Can we
please.
get some music here?
Well, my hip was in agony
There we
in
go.
multiple spots, and I feel like I kind of need to change my tune here. And I went into the office and
Ooh.
I laid down on the table,
Oh,
and
here we go. That's getting interesting.
I had to pull my pants down.
Ooh, that's deep.
And
Oh, no.
Sorry. All right.
anyways, my hip was hurting terribly, and where it was hurting was not at all where his magical finger pointed right to. And when he did, I about came off the table because it hurt so bad. And then he put a needle in it, and it was better.
Hey. there you
Yay!
go.
He's amazing.
gotta
Yay!
Yay. Thank you. Oh,
Steve and the
but
magic
Hey,
finger.
every
and
blind
needle.
hog finds a acorn.
But enough
occasionally.
about me.
Yes.
I'm just glad you're feeling better.
Yes,
I
me too.
kid,
Thank you.
but I'm just glad you feel better. All right.
Well, if you want somebody that's a professional needle sticker in her, you just call me.
Yes, well,
Okay,
I shot her
yes.
up with
No, I know,
Celestone
I
and
know.
Marcaine and Lidocaine. So
No, Dr. Steve has a good
What
touch.
do you shoot up with?
Whatever
Well, he-
whatever I got available.
with astragalus,
Yeah,
astragalus,
that's
Now,
astragalus.
I
Some
tried, and
ginseng,
you
yeah.
pawned me off on one of your minions.
Yes. Oh, did you? Oh, yeah. She was good though, wasn't she?
Yeah, she was
Okay,
great.
Good.
Oh, that's right. Yeah.
Oh,
yeah,
that is right. Yeah. Okay.
yeah. Okay. Anyway.
Good.
All right. Here now we're just telling stories that only we know what we're talking about. That's not good. For
Boring.
Great radio.
All
My
right.
bad.
So post-op alias,
Again.
there you go.
Again.
All right. Sorry.
Hey, Dr. Steve, it's Mike
Jesus.
from New York calling.
Hey, Mike.
Hope you're doing well.
Yeah, man.
I have a question for you. You always hear about people with cancer. So you get stage 1 through 4.
Yeah.
And stage 4 is when it moves to another organ or another part of the body.
Yeah.
Is it possible to get 2 stage 1 cancers?
Yes.
Like have cancer in the lung and in the kidney?
Yep.
And they're not really related to each other?
Absolutely.
Or is that really not something that happens? Thanks a lot.
No, dude. Yeah, that's a great question. It does happen. It's just called second primary. So people can have two different primaries. Some people are predisposed to cancer, and they'll get, just as he said, they could get prostate cancer and lung cancer, or a sarcoma and a carcinoma somewhere else. We've all seen cases like that. Absolutely, it can happen. It can happen at the same time, although that's unusual, and that screws everybody up when it happens, because they're also assuming that the first cancer they found was the primary, and then the second cancer that they see is a metastatic cancer. But then they biopsy that metastasis, quote unquote, and it turns out to be a completely different cancer. So that is unusual, but it happens. And then and then sometimes it can be separated in time. So most of the time that's what we see. But anyway, excellent question. I do want to do this one. This one is an interesting question.
Hey, Dr. Steve. Hey there, Dr. Scott. It's Natalie from Northern Ontario, Canada calling.
Hello,
How are
Natalie.
you?
Good. We're good. How are you?
And if Stacy happens to be with you, hi, Stacy.
Hello.
Glad you're part of the show now and that you're enjoying your retirement.
Yeah, and people remember me, but you guys.
Don't rub it in.
A news broadcast and ensuing articles that followed from Fox News anchor, what's his name now?
Tucker Carlson.
I'm having a brain fart.
It's okay.
Tucker Carlson.
Yes, there you go.
And it has to do with this bromeotherapy, where apparently you're shining reddish near-infrared light at your nads, and it's supposed to boost testosterone and make you manly. If you ever had a chance to look at that video where you have these shirtless men doing things, and the climax at the end of that ad spot is somebody standing with the red light shining on his nads, explain to me, please, how tanning your testicles would boost testosterone. I think it's absolutely ridiculous. I did a quick search on PubMed, found some reference to near-infrared for cancer. Also believe in the use of. Sorry, there's somebody at my school door.
Okay.
In the use of light for seasonal affective disorder, Northern Canada, long winter
Yes,
nights.
that's a whole different
So if you
one.
can explain that, that would be awesome. Thanks. Have a great day.
Yep. Thank you. And
Well, that's a good question.
Excellent.
That is.
Yep. So first thing, you can't tan your testicles with red light. Ultraviolet light is what tans skin, not near infrared. So infrared wavelengths basically is just heat, right? That's so things, black body emitters, for those that remember their physics, when they're emitting in the infrared, that's basically just the heat that's coming off of. That's how we perceive that. We can't see infrared. You'd have to have different kinds of receptors in the eye to be able to see it. But it's all along the spectrum. And visual light's just a very narrow spectrum in the electromagnetic. It's a very narrow segment of the electromagnetic spectrum. Red light therapy has been shown to boost things like plant growth on the space station. Some studies have shown benefits with pain relief, but it's basically, when it's infrared, again, you're talking about heat. And, they did these light-emitting diodes that were implanted in these helmets, and Tacey and I bought this laser thing that you run through your hair. And actually, when you stimulate follicles with red light, they're supposed to grow more readily and stimulate growth in some of the follicles. And there is some decent data on this stuff. But, I searched and searched and searched for infrared light on the scrotum boosting fertility and couldn't find a single thing. So I will keep looking, but it sounds kind of like malarkey to me.
Well,
yeah, go ahead.
Well, I was just saying the other thing is we know that heat can kill sperm, so that kind of almost sounds counterintuitive.
Yeah, you
to
know
a certain
what?
Degree, to a certain degree.
You're almost a damn genius, Dr. Scott, because it's true the scrotum is outside the
For a
body
reason.
for a reason, because for whatever reason, the gonads in the male cannot produce sperm unless it's like 3 degrees below body temperature.
Right.
Why?
Who knows?
Who the hell knows?
Yeah.
It's all mammals have these dangling
Sacks
things.
of love.
Sacks.
Or yeah. So I don't think ours dangle so much anymore. It's more like a
No, they're mostly
shriveled up and.
No, it's just was it Anthony Cumia or one of those guys said it's like saltwater taffy plastered to your thighs. And that's what our scrotums are like at our age.
Pretty much.
Tacy was
Pretty
that
much
was very she's very attracted to me right now.
I'm not saying I'm opposed to tanning my testicles,
But
I'm
you
also-
can't tan with infrared
I
light.
know,
That's the
I
first
know, I
thing.
know,
But they
yeah.
talk about that. Oh, you're tanning the jungle region.
Yeah.
So I will continue to research this, see if I can find anything. But Dr. Scott's right.
Mm-hmm.
If you are using infrared light and heating up your testicles, you're actually going to decrease spermatogenesis.
Mm-hmm.
Now, I don't know what it does to testosterone. Yeah, go ahead.
And as far as the far infrared lights, we do use that a lot in therapies for people with
Of
diabetic
course.
neuropathies and chemotherapy-induced neuropathies. So I mean,
Yep.
it certainly does have its place. but,
Absolutely.
yeah, but
There's a whole clinic that does nothing but laser therapy for people with neuropathy. And I'd say about 50% of the people that go swear that it helps them.
Oh,
So,
shoot, yeah.
And
Yeah.
a quick search that I just did
Mm-hmm.
shows promising results for increasing testosterone levels, but
From what?
infrared or near infrared
No,
light
I know,
therapy.
but promising from what? What results are they talking about?
I'm not through it all, but it also goes through the next sentence to talk about how the light therapy device that delivers optimal power without producing heat.
Yeah.
Oh, okay.
Okay.
So-
Well, okay. If it's that's great. But
It's
if
just
if it's
correct.
infrared light, it's heat.
Yes.
Anyway, all right. Ah, dang it. Hey, we'll continue to research this. And thank you all for being here, Dr. Scott.
Thank you.
Dr. Carey, Amanda, Tacy, thank you for being here. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye,
Thanks,
everybody.
Goodbye. Thank you.
Bye.
All right. So what we'll do is let's continue that now.
Okay.
And I'm going to look this up on PubMed real quick.
Yeah.
And so I'm going to go back and cut that section. So infrared.
We have 30 seconds so I can make a quick phone call.
Yeah, of course.
Yeah, just a quick phone call. Take
Do
two
you have to get out of here?
No. No. Come in here.
I can get out of here.
No one.
Near infrared
No, I'm-
and spermatogenesis.
Yes.
It's starting to sweat. It's a little hot in here.
Sorry.
Oh God, I'm stuck.
Multiphoton microscopy can be used to differentiate neural from okay. Nope. Near infrared and testosterone
Eight or nine.
levels.
Probably 9. I'm thinking. Yes, if that's okay with you. Are you the best? Give us a
Nothing.
next month.
Nothing. Okay. All right.
Yours are bigger.
You still doing yoga Wednesdays?
Yeah, a lot of times. I don't get out here every night. Sometimes I do. I don't do as much yoga as I used to. I need to do more though.
Okay, so we're gonna start there.
Yoga is so good.
I love it.
I don't do it.
Are you done with your phone call?
Yes, sir. Yeah,
Okay.
I'm good to go. Thanks.
Let's just do the. Let's
Yeah.
do the.
Finish up on it.
Let's just finish up on that.
That's cool.
Is this the podcast?
Yeah, this
Yeah,
this is
podcast.
just the end of the podcast. So anyway, I looked and on PubMed and found absolutely nothing. This is what I searched: near infrared and testosterone levels. There's 3 papers, and none of them are related to this. So I don't see a decent study that talks about this. And somebody was saying, well, they use UV light, and it's like, no, I know that's not right. And if UV light doesn't penetrate the skin, that's the whole point of
It burns it,
sunburn.
yeah.
It's
It just
absorbed
burns it,
by
yeah.
the skin. And if you hold up like a scrotum, all you're going to see is red light through it. Like if you stretch it out enough to look through a scrotum, all you'll see is red light. Only the longer wavelengths can get through there. So anyway, all right, very good. Well, that was interesting, but I will continue to look into that. If we find something fascinating, we'll bring it to you. Don't forget to check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. And we can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, that Gould Girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Howdy Gooplunk, Eric Nagel, the Port Charlotte Horde, the Saratoga Skank, the Florida Floozy, the St. Pete Barkeep Blower, the Tampa Dali Museum Diddler, Percy Dumb, Roland Campos, Sister of Chris, Sam Roberts, She Who Owns Pigs and Snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's Double Steve Tucci, the great Rob Bartlett, Vic's Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Deviated Septum, producer Chris, Jenny Jingles, the inimitable Vincent Paulino, everybody, Eric Zane, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends G-Back and Fez Watley, whose support of this show never went unappreciated. Listen to our SiriusXM show on the Faction Talk channel. SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. Thank you, everybody.
Goodbye.
Goodbye.
Thanks,
Goodbye,
everybody.
everyone.
Thank you. There you go.
Goodbye,
Thank
everyone.
Bye. Bye. Thank you.
Thank you.
All right. See you later.
Thank you, everyone. Yeah, Charlie.
All right.
Yeah,
Okay.
yeah, thank you.
Let's do the beginning. That was excellent. All right. Very good. Perfect. All right. You ready?
How many chickens does it take to change a light bulb? I'm not sure. We'll have to wait until they get back from across the road. What's the difference between chickens and umpires? Chickens understand what bok means. Bok bok, bok bok. Why does a chicken coop only have 2 doors? Because if it had 4, it would be a chicken sedan. What happened to the letter that fell off the billboard? Nothing. It's just a little dirt E.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine from the world-famous Cardiff Electric Network Studios. The first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical provider who gives me street cred the Wacko Alternative Medicine Assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we also have Tacey's in here, too.
What's up?
And we have Dr. Carey. Hello, Dr. Carey.
Hello, Dr. Steve.
And Amanda. We haven't come up with a radio name for you yet. I came up with some wildly inappropriate ones that went over like a lead balloon, but so until then, you're Amanda.
Sounds good. I'm anxiously awaiting my name.
Okay, very good. But maybe we'll put that out to the listeners to come up with a name for you.
Oh, dear.
This is a show for people who had never listened to a medical show on the radio or the internet. And if you put out your email address, what you would get back is just a whole inbox full of dick pics. So we won't be doing that.
No.
If you have a question, you're embarrassed to take your regular medical provider. If you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, for the practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, massage therapist, proctologist, a Zydeco musician, or whatever. Okay. I don't know. Well, you'll know why in a minute. Check out stuff.drsteve.com for all of your shopping needs. You can go there, scroll down, you see some cool stuff that we talk about on the show, or you can just click straight through to Amazon. It really does help us out a lot. So go to stuff.drsteve.com. Please check out Dr. Scott's website, simplyherbals.net. That's simplyherbals.net. Hey, by any chance, have you talked to your the person that sold you the spray bottles about getting in version 2 of this new CBD laced thing of getting a more voluminous spray out of it? Is that something? I mean, because this one's different than your last one. We talked about this a couple times ago.
I haven't, but that's actually a pretty good idea.
Well, it just
I can certainly look. Yeah.
What about that spelling error?
Yeah.
Well, yeah, and Carissa found a spelling error on Scott's website.
I'm on it.
It's good for Stas.
I'm a phonic speller.
I was going to say that he would say that's how they spell it in China.
That's right. That's how I spell Chinese. Stress. That's right.
That's a old linger longer on that one. Anyway, and then check out our Patreon, patreon.com/weirdmedicine, dropping this on the 29th, which is on Friday. We're recording this on the 27th. Jim Norton comes into the exam room. And the exam room, they get to, we have celebrities in, and they get to ask questions of us rather than us interviewing them. So it's kind of fun. And they get undivided attention. And we've got some super secret people that are going to be coming later on. And but anyway, check that out at patreon.com/weirdmedicine. All right.
Like double secret.
Yeah, double secret probation.
Double secret.
Okay, there we go. We're done. So, you guys, Tacey, you want to join the chorus and sing?
Nope.
Did you know that I wrote a version of "In Spite of Ourselves" with from Myrtle's standpoint?
No.
Amanda wants to sing.
Does she?
Yeah.
Oh,
Do you sing?
man.
You play instruments, right? Yeah. What do you play? Piano, right?
Piano and clarinet.
Oh yeah.
Ooh.
Oh.
Twofer.
Mm-hmm.
I suck at both.
And she can sing.
Bullshit.
Can she? Oh shit, she's hard.
Yes.
Let me see if I can find that. In spite of ourselves.
Cannot.
I would like to
no,
have
you
a,
can't.
Well, honey.
a glass of wine.
Ooh, yes.
I know
You
we're not
would-
supposed to drink on the weekends, but
Well, there's no supposed to. If you make a thing out of it, then it becomes a thing.
Well,
Yeah, don't make it a thing out of it. It's all good.
okay.
Have a drink.
Where you going, Goober?
I'm just stuck.
Cooling off?
Yeah. Oh, well, your wife said she wanted wine, so I was trying to get the hell out of
Oh, okay. Well, your wife said she wanted
Well,
wine.
somebody like me to bring wine up to
Whiskey
them?
and wine.
I don't care for any.
No.
I don't drink during the week.
Uh-oh.
Unless I need to.
Weren't you the lightweight? Oh, good.
We've seen Dr. Steve as a lightweight. Yes,
Oh.
we have. Yes, we have.
I've been very naughty in the past.
Well,
Not naughty,
If I have
naughty.
somebody
No,
to
you were
drink with,
bad.
so when y'all come down, we'll do it.
But
You
I
were-
have.
you were
No,
not-
no, no, no.
It's a little
No,
hot
do it now. Come on, back up.
You were not bad.
It's, okay, let's see here.
Yeah, you are.
Yeah, it's cooler out there. It's way cooler because there's ham radio out there, and that's cool. 04 27 22 recording. Okay, let me save that. All right. Well, if Tacey isn't here, I'm not doing In Spite of Ourselves. What do you want to do? You had an idea for a song.
I thought about going old school.
Yep. What is it?
It'll make me down the pallet on the floor.
What are you playing?
Make me down the pallet on the floor. It's an old Doc Watson.
Okay, I don't know it.
Make.
It's G.
Make me down the pallet on your floor. Make me down the pallet on your floor.
Yeah.
Honey, make it down, make it soft and low. Somewhere where my good gal she won't go.
I remember.
It's been a long time, yeah. Yeah, it's been a long time since we played that.
Do it nice and slow so I
Will
can
do.
remember how we played it.
Yeah, we can do slow.
Just the first time through. You guys won't be able to hear anything without that.
Nah. Make me down the pallet on your floor. Make me down the pallet on your A floor.
This is not right. I know this isn't how we played it.
Honey,
before.
make it down, make it soft and low. Somewhere where my good gal she won't go. We don't have to use that A, but that A.
No, we should do it right. But it had a chromatic progression. Let me see.
It's that's the Doc Watson version.
Oh, okay.
In
That might be the
G.
problem.
is Make Me a Pallet on the Floor.
Oh, here it goes. That's not that's Del McCurry's voice.
Mississippi John Hurt. Yeah, that's the one, the version I remember. So let me see. Sorry, everybody. You know, this part we're just dicking around.
Yeah,
so.
this is not medicine anymore. This is just jamming. A pallet. After this, move over to the hot tub. Dr. Steve pull the
Chords. Because we used to play this. We have
Yeah,
this.
yeah.
We have this in our songbook.
Yep, and it pretty sure it's in G.
What? Yeah, I don't care what key it's
Make me down a pallet on your floor. Make me down a pallet on your floor.
Now, when you sing "make," what chord is that?
Make
what
is G. Yeah.
That's a G. Okay,
Yeah.
hang on. Let me transpose this.
Make me down a pallet on your floor. We'll just not do the A and just stay with the D.
No. So yeah, it goes A. Hang on. A.
Yep.
And then A major 7. And then F sharp.
Yep.
G. D. A. D.
Make me down a pallet on your floor. Uh-oh. Yep. Oh, honey, make it down, make it soft and low. Somewhere where my good gal she won't go. I'm going up the country through that sleet and snow. I'm going up the country through that sleet and snow. Going up that country through that sleet and snow. Ain't no telling just how far I may go. I get my breakfast here and my dinner in Tennessee. I I get my breakfast here and my dinner in Tennessee.
Ah, shit.
Honey, I get my breakfast here and my dinner in Tennessee. I told you I was coming, so you better look for me. So make me down a pallet on your floor. Make me down a pallet on your floor. Oh, shit. Monday, make it down, make it soft and low. Somewhere where my good gal, she won't go.
G.
Yeah.
Okay. All right. You ready?
I'm ready. Let me change my
We
pick.
probably were a little bit
Quick.
ambitious trying to do it that fast, but it's
A little
okay.
quick. We'll slow down just.
No. It's good.
Yeah.
You know.
what
So
the-
let me see.
I'm super impressed.
Not bad, huh? You like the little Doc Watson, huh?
Right?
Can you sing with me?
No.
Yes.
You can sing the Make Me Down the Pallet on the Floor.
I've never heard the song before in my life.
Come here, sit by me.
Lyrics.
Come here, sit by me.
Do it. Yeah.
Come sit by me. Seriously.
I will not. You will. You're gonna have me sing.
But you got to do one thing for me. Put your headset on there. When we get down to kind of somewhere down here, if you'll just arrow down.
Yeah, you gotta. Oh, you have headphones on. Okay.
If you'll just arrow down, just
I'm not participating.
because this thing ain't going fast enough.
Okay.
If you'll just arrow down, that'll be perfect. So just kind of when we get down to.
You gonna sing, Amanda?
She gonna harmonize with me.
She gonna harmonize? Okay.
I can't harmonize.
So if you'll just, so what we'll do, I'll do the verse and then we'll both do the chorus, okay?
Take me down.
Okay.
On your floor.
Good.
If I have to.
No.
Take me down, up and low. Man, I'm broken. Don't know where to go.
Make me down, ballad on your floor. Make me down, ballad on your floor. Honey, make it down, make it soft and low. Somewhere where my good gal, she won't go. I'm going up the country through that heat and snow. I'm going up the country through that sleet and snow. Honey, I'm going up the country through that sleet and snow. Ain't no telling just how far I may go. Make me out a pallet on your floor. There you go. Make me down a pallet on your floor. Honey, make it down, make it soft and low. And live with my good girl, she won't know. There you go. Getting breakfast here and my dinner in Tennessee. I get my breakfast here and my dinner in Tennessee. Honey, I get my breakfast here and my dinner in Tennessee. I told you I was coming, so you better click for me. Ready? Make me down a pallet on your floor. Make me down a pallet on your floor. Honey, make it down, make it soft and low. Somewhere where my good girl, she won't go. Scroll down there.
I'll figure that one out by the end of
No, I will lay down on your bed. You know I can't lay down on your bed. Now, honey, I can't lay down across your pretty bed. My good woman, she might shoot and kill me dead. So make me down a pallet on your floor. Make me down a pallet on your floor. Honey, make it down, make it soft and low. Somewhere where my good girl, she won't go. And don't you let my good girl catch you here.
What?
You good? Don't you let my good girl catch you here. If you do, she might shoot and cut and stomp you too. There ain't no telling what that crazy bitch might do. So make me down, pallet on your floor. Make me down, pallet on your floor. Honey, make it down, make it soft and low. Somewhere with my good girl, she won't go. Last verse. May I've been sleeping back and tired or shore. Way I'm sleeping, my back and shoulders sore. Honey, way I've been sleeping, my back and shoulders sore. I don't think I'll be sleeping here anymore. So make me down, pallet on your floor. Make me down, pallet on your floor. Well, honey, Break it down, make it soft and low. That way, maybe my good girl, she won't know. There you go.
Ah, boo. I messed that up so bad.
That was good, Steve. That's the first time. Now, listen, I'm going to tell you, that's the first time we played that in
Oh, we used to play that live
3 or 4 years,
way
yeah.
before COVID, and I
Way before
played it a
COVID,
whole
yeah.
lot better than that.
Oh, that's such a fun song. Thank you.
That is a good one, yeah.
Good job singing, man. Well, I figured out something.
All right, what else we gonna play?
I figured one thing
Led
we one thing we can't do is I can't have lotion on my fingers. That son of a bitch was let out. Let's do let's go back and what we hadn't done forever with a mandolin is Thrill Is Gone. We played it the other day with a guitar, but no mandolin.
Okay.
Thrill Is Gone in A minor.
I've got to go rescue my in-laws from the children.
Oh,
Are you
yeah.
leaving?
Hey, thank you guys.
Oh, what the hell?
I know. Don't worry, I'm staying for the next song.
You are staying?
Yes.
Okay. Oh, you came separately?
Yeah.
Okay. I will see you tomorrow afternoon.
Sounds good.
Okay. Thanks for coming. Oh, yeah. No, it was fun. Do what? What'd she say? I couldn't hear her.
She said, "Thanks for letting me screw it up."
Oh, God.
she didn't. I screwed it up. What are you talking about? I was terrible today.
She was super great.
These Wednesdays when I have to actually drive 2 hours back and forth, and then it's always on the Wednesday when I change my Invisaligns and I sound like I've got my dentures clacking together. It's terrible. And I'm just burned out, not on doing the show, but I'm just burned out. And then I try to, come in here and be entertaining. It's hard to do. I felt like I was just burbling around, sounding like an idiot today.
You were.
They love it. Love it. Love it.
You always
Love
keep
was
it
saying
real.
She's wanting to hear I Know You're Right, or
Who, Lovett said that?
Yeah, Lovett said she lived.
That's our. You know who that is? That's our buddy Peppermint Patty, and I had no idea that's who that was.
I did not know. We could do a little I Know You're Right, or you want to stick with that?
Yeah, we could do it.
Oh, I love it. And what do you want to do? D?
I don't care.
It's going to be D, C, G, D. And remember, the very last thing is going to be an F. I know.
Let's run through it just for a second.
F, C, F, C, G.
Okay.
I know you right are gonna miss me when I'm gone. I know you right are gonna miss me when I'm gone. Gonna miss you, baby, from rolling in your arms. Lay down last night, Lord, I could not take my rest. Lay down last night, Lord, I could not take my rest. My mind was one like a wild geese in the wind. The sun will shine on my back door someday. The sun will shine on my back door someday. The March winds will blow all my troubles away. I know you right are gonna miss me when I'm gone. I know you right are gonna miss me when I'm gone. Blow all my troubles away. I wish I was a headlight on a northbound train. I wish I was a headlight on a northbound train. I'd shed my light through the cool Colorado rain. Rather drink muddy water than sleep in a hollow log. Rather drink muddy water than sleep in a hollow log. Then stay here in Frisco and get treated like a dirty old dog. I know you rider gonna miss me when I'm gone. I know you rider gonna miss me when I'm gone. Gonna miss you, baby, from rolling in your arms. There you go. There you go.
I wish I had a drop that just went meh. Meh.
Oh, I love it. I love it, love it, love it. Such a beautiful song. Such a beautiful song.
We learned all these alt rock songs, and then we ended up playing all this stuff from a million years ago, but still fun.
It is fun.
What about The Funeral? Do you still remember The Funeral?
I'm sure if I saw it.
Do you have it?
Yes. Funeral song.
Do you know this one, Carissa? You won't recognize it the way we do it.
No.
My idea was to take alt rock songs, like good ones, like Arcade Fire and stuff like that, and do it, score it for mandolin and bass and redneck voice.
Hillbilly voice.
Yeah.
You do have a good one.
Shoot.
It's Band of Horses, The Funeral.
Band of Horses. I appreciate that. I've got a total hillbilly voice. If I don't get ahead of myself.
My grandpa used to sing with a bluegrass band.
Really?
Good Night.
Oh no. Called Good Night? I've never heard of it.
Oh my goodness. Like, I feel like you would know them.
Yeah. I probably will. I just might.
I'm coming up only to hold you under. You remember that? Or we could do Creep.
I think I can pull off Funeral. The one I do.
What key you want to do it in, though?
Let's do it.
Probably not that A flat shit.
No. Is this I'm coming up only to hold you under?
Yep.
I'm coming up. I got an F. I'm coming.
You mean it's in F or it starts with the F?
Yeah.
Okay. It doesn't necessarily mean the same thing.
Do you know who this is by picture?
Okay, let me see.
Okay. Coming up only to hold you under. Coming up only
Those faces
to
are familiar.
show
Who are those people?
you're
Oh,
wrong.
that's me.
Is that you? Okay.
Yeah,
And to know
but
you
the man
is
is
hard.
the singer in the
We
group, and I cannot for
wonder.
my life of me.
To know you all. Wait a sec. To know you all wrong. We want.
I don't know who this.
I'm going down.
Hey, we'll be down there in just a sec.
You're leaving? 2, 3, 4, F. I'm coming up only to hold you, A minor.
Oh, I'm with you. Okay, yeah.
Coming up only to show you're wrong. And to know you is hard. We wonder. Know you all wrong. We warn. Really too late to call, so we wait for. You gotta sing this.
You're doing good.
Wanting to wake you is all we got. To know me is as hardly golden is to know me all wrong. They warn. At every occasion, I'll be ready for the funeral. At every occasion, once more, it's called the funeral. At every occasion, oh, I'm ready for the funeral. At every occasion, 1 billion day funeral. Coming up only to hold you under, and I lost the thing. Okay, so that's how it goes.
When those damn things don't scroll forward, you're screwed.
Yeah. Because I don't know the song.
Okay.
Anyway, we should do that song. We need to practice it. We need to listen to it.
Yeah. Listen to it again.
We'll have the timing off.
Land of Horses up.
That's a good one.
Yeah. We'll have to practice that one more time.
All right.
We only leave with one that's decent before.
Yeah. We got to play one half-ass before we get out of here.
It's not good.
What are we doing? I have no idea. What are we playing?
Thrill's Gone.
Oh, really? Okay. Key were you playing that in?
A minor.
Okay.
Yeah, we haven't done it with a mandolin forever. This is by far my preferred.
Is that the key you want to play it in? Or did you want to play it in?
Right there, yeah. Thrill is gone. Thrill has gone away. Thrill is gone. Thrill has gone away. You know you done me wrong, and you'll be sorry someday. Thrill is gone now. Thrill is gone from me. Yeah. Thrill is gone. Thrill is gone from me. You know that I'll live on. So lonely I'll be.
this will not work. You got to record.
You know I'm free now, baby. Free from your spell. Free now, baby. Free from your spell. Now it's all over. Like Lewis wish you well. Thrill is gone now. Thrill is gone away. Thrill is gone now, baby. Thrill is gone away. You know you done me wrong, and you'll be sorry someday.
Oops.
Thrill is gone. Thrill is gone from me. Thrill is gone now, baby. Thrill is gone from me. You know you done me wrong. So sorry you should be. I'll do it.
I got to practice.
Your
My fingers are just, I couldn't do it.
No, you were well. You know, I
No,
started us off a little fast. And
That's all right. That's all right. Well, I like it like that.
The
I
bass
just couldn't
sounds
do
good.
it. I got to, I've just lost the stamina in my fingers.
That's because you never get a chance to play any.
Yeah.
That doesn't make a difference.
But remember, what you lose in speed as you get older, you gain in